Hello, I'm Dr. Brian Grossman. I'm a spine surgeon at Southern California Orthopedic Institute. I specialize in treating conditions and injuries of the neck and back. In this video, I will be discussing what to expect during your first visit for back pain. Back pain is one of the most common reasons that prompt patients to seek care from a doctor. So if you are having back pain, you're not alone. It's estimated that approximately 80% of the total population will experience back pain at some point in their life. It's one of the most common reasons for working people to take time off of work. In the United States, about $50 billion is spent on back pain every year, which makes it third behind heart disease and cancer as one of the most expensive conditions to treat. The good news is that most back pain resolves with simple treatment. What are the most common causes of back pain? Most low back pain is the result of muscle strains or sprains. The muscles and ligaments in the back can be stretched due to overactivity, sudden movements, or poor body mechanics while lifting. Symptoms include pain and stiffness in the lower back, as well as muscle spasms. Disc injury is another common cause of low back pain. The discs are shock absorbers located between the bones of the spine and are made of cartilage. Just like cartilage in other areas of the body, the discs undergo age-related wear and tear and become more prone to injury or irritation. Sometimes discs can herniate, which means that the cushion that is normally located between the spinal vertebrae is pushed outside of its normal position where it can push against the spinal cord or nerves. This can result in pain or numbness radiating down the leg, which is referred to as sciatica. Spinal stenosis is a condition when the spinal column narrows and puts pressure on the spinal cord and nerves. It's usually caused by degeneration of the discs and overgrowth of bone or ligaments due to arthritis. Symptoms usually caused by the pressure on the spinal nerves may include numbness, cramping, and weakness in the legs, usually worse with standing or walking. Most back pain resolves with time, some rest, and over-the-counter medications like Tylenol, ibuprofen, or naproxen. If the symptoms persist beyond a few days, or improve but don't completely resolve, or if there are recurring episodes of back pain, that may be a reason to seek medical care. If there's also radiating leg pain or numbness, medical evaluation should be considered. Now, if you're experiencing weakness, lack of bowel control, or fever, then that's a signal to seek care right away. It's always helpful if a patient is prepared to give a complete medical history, a list of their medications and allergies, a list of medical conditions they might have, such as high blood pressure, diabetes, and a list of previous surgeries, especially if it's spine surgery, is often helpful. If they've ever undergone x-rays, MRIs, or CT scans, it would be helpful if they would bring those in, or at least a written report. Usually I'll ask you questions about your pain, how it happened, how long you've had it, previous episodes, previous treatment, and get a good understanding of where you hurt and what makes it better and what makes it worse. I'll perform an examination of your spine to determine exactly where it is that you hurt and how your symptoms have affected your motion, and if there are any effects on the nerves in your legs. I'll often obtain x-rays of your spine to look for evidence of arthritis or damage to the discs. Because most lower back pain resolves using simple treatments, we may not order additional tests right away, but if necessary, depending on the findings, we might order additional tests such as an MRI, a CT scan, bone scan, or a nerve test. Patients often ask what they can do on their own before their first visit. First of all, rest. Stop your normal physical activities for a couple of days to give your back a chance to rest. You can apply ice for the first 2 or 3 days to the area that hurts the most, and then after that, switching to heat might be helpful. Taking over-the-counter medications like Motrin or Advil or Tylenol can often relieve the pain and inflammation. If lying on your back causes more discomfort, try lying on your side with a pillow between your knees and your knees bent. Sometimes a warm bath can often relax your stiff and knotted muscles in your back and make you feel better. Treatment varies depending on the exact cause of your symptoms. Most common treatments include medications such as muscle relaxants, non-steroidal anti-inflammatories like Motrin or Advil, and sometimes narcotic medications such as Vicodin or Norco if your pain is severe. Physical therapy, including massage, stretching, and strengthening exercises, as well as back and spinal manipulation, is often prescribed. Sometimes we'll recommend injecting cortisone around the nerves. This is known as an epidural steroid injection. It's usually done under sedation so that patients don't experience much discomfort from the procedure, and it can often reduce symptoms significantly. Patients often ask if there are ways that they can prevent back pain in the future. Actually, there are several ways that patients can help to prevent episodes of back pain. One thing that often helps is to participate in a core strengthening exercise program. It's been found that by strengthening the muscles that support the spine, your spine is less likely to go into spasm or to experience pain. If you're overweight, losing weight can also be helpful. Remembering to lift items properly by bending at the knees and lifting with your legs will help to prevent back pain. And maintaining proper posture or sleeping on a firm surface is also helpful. Sitting on supportive chairs that are at the correct height. And for women, avoiding high-heeled shoes can be helpful. Finally, quitting smoking can also help because it's been shown that nicotine actually participates in the degenerative process of the discs. Surgery is generally reserved for those severe cases that just don't respond to conservative care. The goal of surgery is to correct the problem using the least invasive options possible. Possible surgical procedures include a discectomy. That's a procedure where part of the disc that's pressing on the nerve is removed. Generally, the procedure is done using an operating microscope, and a small incision is made over the disc, and a small amount of the disc is removed to make more room for the nerve. Laminectomy is a procedure where more bone is removed in order to make more room for the nerves within the spinal canal. Finally, a spinal fusion is sometimes performed, and that's a procedure where two or more bones are fused together utilizing various bone grafts or implants such as titanium screws and rods, and that is generally used in cases where there is instability of the spine in order to prevent further instability or to correct a deformity. To learn more about back pain and back surgery, log on to scoi.com. Thanks again.